Click it.
Yeah, just left or right.
It's on already.
Yeah, you just look
Okay,
at
and I can't see it here. Okay, thanks. Good afternoon. For my sins, I'm being actually being targeted to talk about this topic. It's a little bit of a hot topic, I do understand. But I do welcome you. I think it's great of you on a Saturday afternoon coming to listen to all this. Anyway, the topic is about narrow diameter implants, right? So when, as Siulun explained, when we started out, we had a whole lot of things to look through, see? And when we look through all this, we actually look through hundreds and hundreds of papers, and we look through the words mini, micro, small diameter implants. We were looking, and then in the beginning it really confused us quite a lot, because in the 2005, 2006, the Koreans started using these mini anchorage implants, which they also call mini implants. So all the articles that were printed were also called mini implants. They were like this, small little anchorage implants, and they call them mini implants. So this is not what we were looking at, right? And this is the sort of thing that we're having, the anchorage points were there, and they were retracting teeth. So we're not talking about that. So after a lot of discussion, we eventually went down to have the narrow diameter implants to be sizes below 3.5. Now, why this magic number? Because originally the implants that were brought up were, Brannemark, they all did the implant. They did a lot of research, and they did 15 years of research before they launched it in the market in the 1980s. And the reason why they came to 3.75 was their minimum size at the time, because that they felt was the right size for humans. So for a long time it became 3.5, then it became 4. Some people, then we went on to 5, what they call the wide platform implants, then they went on to 6. So therefore, we then call the narrow implants anything below 3.5, all right? So, okay, so then we looked through a whole series of papers, and we came through that there are some things that it does work. So it's not that all narrow implants don't work, see. So we did find there were lots of papers, not a lot of papers, quite a few papers, and we were looking at 5-year success rates, predictability, right? And they were the 2.5 to 3.3 millimeter implants, and this can be predictably used for mandibular overdentures. Mandibular, not maxilla, mandibular implant. And these were like, for instance, like so. These are they are 3 millimeter diameter, and then overdenture that fits over there. That's quite reasonably predictable, right? And we looked at the papers, and they were like between 2 to 4 implants. You can put 2, right? It also was successful. The implants, as I said, were that sort of size, 2.5 to 3.3, and there was a waiting period. All the papers that were saying, it's not like immediate loading, all right? So there was a waiting period of maybe 3 months, and then they loaded it, and these papers were quite good, 6 to 7 years survival implant. Pretty good, right? So therefore, we could say, and their success rate was about 95 to 96%, which is fair, which is about average, pretty good. Anything above 95. You must remember, above 90 is already pretty good for human tissue, implants for thing, because implants actually got a very, very bad name. The Linkau, they all did the implants in the 40s and 50s. 45% success rate, 55% failure. That's why implants got into a very, very bad name, right? So therefore, 95 is actually a pretty good success rate, right? Then when we're looking through that papers, then we'll find a few papers that were saying that from 2.9 to 3.25 were also used in upper laterals, single tooth, upper laterals, and lower incisors. And it seems sensible, because in the upper lateral region it's very narrow, and in the lower incisor region is pretty narrow. So then they were using a 2.5 implant in there, and now please note that was a pretty good emergence profile for this very narrow implant here. The emergence profile was important. Yeah. So that was considered fairly successful. Okay, then these are the papers. After we've done the Medline search and PubMed, we went to Systemica Medica, we went to the Cochrane's, we went through, this is a wonderful, actually, a Cochrane's database, systemic reviews. We came to all these journals. These were peer-reviewed, proper journals, and we were looking for controlled trials, all right? We want to have something that's controlled trials. So these are all the journals amongst some of the journals that we looked through, and there were plenty of those. And we came to this conclusion that any of the implants below 2.5, any clinical data regarding implants below 2.5, and these implants are not recommended for routine use. Right? Very strong statement, because we didn't find any control studies. They were all case studies who say, hey, I've done 5 of these, I've done 10 of these, somebody, and then they were commercially supported ones. You know, the company will write, somebody has done 100 implants, and then we looked at those, there were no failures, there were a lot of them saying 100% success rate, and they didn't say whether it's in maxilla, or is it mandible, or is it single tooth, or is it overdenture, not mentioned, see. So we couldn't really say that that was the mainline thinking. Okay, so, I mean, actually I could end like that, but then we thought we would just bring up, right, why these implants are used quite a lot, you know. It's been marketed as being affordable, no surgery, minimally invasive, no flap raised, immediate loading, restoration very simple. Great, this is all what I would like for my patients. Affordable, no surgery, immediate loading, restoration simple. All right, that'd be great, huh? Except there are problems. All right, affordable, all right? So normally we would have put in two implants there for 2 molar teeth, right? So with the mini implants, people were putting in 2 mini implants. It's half the price. So they were putting in 2 mini implants for one, you know, it would have been one implant. Normally you and I would have put in one single implant. They're putting in 2, and then for a molar tooth, and then another one, you know, for a molar tooth. This is another one, a molar tooth there with 2 implants. So that's because of the small size of these implants, right? So is it really affordable? That's questionable. Okay. So then came immediate loading. Hey, it's great, you know, you put in, this person says, in fact, she came back and said she had 9 implants, 1, 2, 3, 4, 5, 1, 2, 3, 4, 9 implants put in, acrylic bridge put straight on. Patient was very happy, really happy, immediate loading, right? Immediate loading, no surgery, just some local anesthetic, no surgery, and it was loaded on. So then 6 months later, quite a lot of problems, right? Very smelly, cannot maintain it, all right? Gums a little bit inflamed. So, okay, the CT scan was done of that same patient, the same patient from just now, and if you look very carefully, here's one that's in the sinus, right? This one is out of the arch. There's the alveolus. This is the canine tooth that's out of the arch. Here's an incisor that's all right, and here is completely out of the arch. No surgery, minimally invasive, and that's what's happening. Because you don't see it, you see. You don't raise a flap, you can put it, you drill a hole through the gum, and then you put your implant. We're seeing this. Because it's linked, 9 implants linked together, we don't see it, right?